what really is autism spectrum disorder, according to the clinicians who actually diagnose it. We're going to dive in and break down the official diagnostic criteria piece by piece to build a super clear and accurate picture. So, let's get right to it. What does it actually mean when a clinician diagnoses autism spectrum disorder, or ASD? What are the specific, concrete signs they are trained to look for? That's exactly what we're going to unpack today as we walk through the official diagnostic framework. Okay, so here's our roadmap for this explainer. First, we'll hit the core definition and its two main features. Then, we're going to unpack what spectrum really means. After that, we'll cover the other criteria needed for a full diagnosis. And finally, we'll look at how ASD can show up across a person's entire life. First up, what exactly is autism spectrum disorder? Probably the most important thing to know right off the bat is that it's classified as a neurodevelopmental condition. And what that really means is that it starts in early development and it affects how the brain grows and gets wired. Okay, so that brings us to the core definition. Clinically, ASD is defined by two key pillars. First, you have persistent challenges in social communication and interaction. And second, there are restricted, repetitive patterns of behavior. And this is super important. A diagnosis requires signs of both of these things. It's not one or the other. So let's break each one down. All right, now we're getting into the real heart of the diagnosis, these two core features. You can think of these as the two main pillars, the essential building blocks. A clinician has to see clear evidence of challenges in both of these big areas to make a diagnosis. The first pillar, which is officially known as criterion A, is all about social communication. And look, this isn't just about being able to talk. It covers the entire complex dance of social interaction, both the words we use and the nonverbal cues we send. The key here is that these challenges have to be persistent, showing up in all sorts of different situations. Now, this part is really broken down into three specific areas. And listen, this is the critical part. For a diagnosis, a person has to show persistent challenges in all three of them. The first is what's called social-emotional reciprocity. That's the natural back and forth of a conversation. The second is nonverbal communication. Things like using eye contact, gestures, and facial expressions together. And the third is the challenge of developing and maintaining relationships, which can range from difficulties in sharing imaginative play as a kid to adjusting behavior to fit different social settings. Okay, so that was pillar number one, social communication. Now, pillar number two, which is known as criterion B, switches gears completely. It focuses on a whole different area, the presence of restricted and repetitive patterns of behavior, interests, or activities. Okay, now with this one, a person has to show at least two of these four types of behavior. It's not all of them, but at least two. So this could be repetitive movements or speech, like lining up toys over and over or repeating phrases. That's something called echolalia. It might be a real insistence on sameness, where even small changes to a routine can be super distressing. Or it could show up as these highly restricted, fixated interests that are just way more intense than usual. And finally, it can involve how a person reacts to sensory input, either being overly sensitive to sounds and textures, or being undersensitive and, say, fascinated by lights. So let's just recap for a second. To meet the clinical criteria for ASD, a person has to have challenges in both of these areas. It's not an either-or deal at all. The diagnosis is defined by this very specific combination of social communication deficits and restricted repetitive behaviors. Okay, so we've got the two core features down. But what about the spectrum part of autism spectrum disorder? This is a really misunderstood idea. Clinically, it's not some simple line from less autistic to more autistic. It's actually a way to describe the level of support an individual needs in their life. So yeah, that word spectrum is all about capturing the incredible diversity you see within autism. It acknowledges that there's this huge variation in how symptoms show up and how severe they are. And to make this official, clinicians actually assign severity levels that directly reflect how much support a person needs to navigate their day-to-day life.
Clinicians use 3 levels to describe this. Level 1 is requiring support, Level 2 is requiring substantial support, and Level 3 is requiring very substantial support. And here's a really important detail. These levels are assigned separately for both social communication and for the repetitive behaviors, because they recognize that someone's needs can be totally different in one area compared to the other.
So those 2 core features are the foundation, for sure, but they're not the whole story. To really make a diagnosis, a clinician has to look at a few more criteria that help build out the full contextualized picture of a person. You can think of these last 3 criteria as really important checkpoints. So criterion C is there to confirm that the symptoms started early in childhood, which points to its neurodevelopmental nature. Criterion D makes sure the symptoms are significant enough to cause real impairment in daily life. And finally, criterion E is a check to make sure the challenges aren't better explained by an intellectual disability on its own. So on top of just meeting those criteria, the diagnostic framework has this really useful tool called specifiers. Think of them like little descriptive tags that clinicians can add to provide crucial individual nuance and create a much more personalized picture of the person. And these specifiers add so much important detail. For example, a diagnosis will note whether it comes with an intellectual impairment or a language impairment. It can also specify if the autism is associated with a known medical or genetic condition, like epilepsy or Fragile X syndrome. Every little detail helps create a more precise picture and helps tailor support.
Now, here's a really interesting statistic to talk about: the gender ratio. Right now, ASD is diagnosed about 3 times more often in males than in females. But, and this is a huge point in the source material, females, especially those who don't have intellectual impairments, might actually be going unrecognized. And a big reason for that might be because their social challenges are more subtle, or because they get really good at developing masking strategies.
Okay, and for our last section, let's talk about how ASD develops over a person's lifetime. Because this is key. It is not a static condition. It really evolves and changes as a person grows. Typically, symptoms get recognized somewhere in the 2nd year of life, and they're often most noticeable in early childhood. But here's what's so important to understand. ASD is not a degenerative disorder. It's the opposite, actually. It's typical to see developmental gains in later childhood, and that process of learning, coping, and compensating continues throughout a person's entire life. And this whole lifelong process of learning and compensating brings up a really critical point about the internal experience, and it's captured just perfectly by this quote from the source. It describes how many adults learn to use strategies to mask their difficulties in public, but suffer from the stress and effort of maintaining a socially acceptable facade. This just perfectly highlights the invisible, personal cost of navigating a neurotypical world. So what's the big takeaway here? What does this all mean? Well, it's that a clinical diagnosis of ASD is so much more than a simple label. It's a really detailed, really structured framework. And understanding these criteria helps all of us move beyond simplistic stereotypes to actually appreciate the specific, individual profile of challenges and strengths that every single autistic person has. You know, this clinical framework is always being researched and refined. And all this progress leaves us with a pretty big question to think about. As our understanding of autism keeps evolving, how can we use what we're learning to better support the incredibly diverse needs and goals of every single individual on the spectrum? Thanks so much for joining